Hello everyone, I'm Dr. Shahida, consultant and fertility specialist at Birla Fertility and IVF. So let's talk about thyroid disorder and its effect on fertility. The thyroid gland secretes the thyroid hormone, which controls the major metabolic activities inside the body, and it also has receptors on reproductive organ, so it controls your menstrual cycle and fertility status as well. So disorder of thyroid gland can be either in the form of hypothyroidism or hyperthyroidism. In hypothyroidism, the thyroid gland will secrete less of thyroid hormone. As a result, it is perceived by the brain, which secretes more TSH hormone. While in hyperthyroidism, what happens is the thyroid gland becomes more active and it starts secreting more thyroid gland, and as a result, the brain reduces the secretion of TSH. Hypothyroidism is more common in the reproductive age group. Around 4 to 8% of the women in the reproductive age group are suffering from hypothyroidism, be it subclinical or overt hypothyroidism. What exactly is subclinical hypothyroidism? So there are ladies or women coming to us telling that my TSH value or the thyroid hormone level is in the normal range as given by the lab, but you are telling me to start thyroid medicine. So what happens, like when a woman is trying to conceive or she is suffering from subfertility, we follow a more strict value or a more strict cutoff in order to treat her to achieve a pregnancy. In subclinical hypothyroidism, your thyroid hormone may be in the normal range, while the TSH may be in the range of 4.5 to 5. What can be the symptoms in women suffering from hypothyroidism? There can be no symptoms at times, or there can be vague symptoms like weight gain, bloating, cold intolerance, dry skin, hair loss, or brittle nails. There can even be menstrual irregularities like prolonged cycles, irregular menses, or anovulation or infertility. What all complications can hypothyroidism lead to? It can lead to failure in conception or recurrent miscarriages, or it can even lead to complications during pregnancy like preeclampsia or preterm labor. While in the baby, it can even lead to development of low IQ and poor psychomotor development. Hence, it becomes very important to identify and treat hypothyroidism at the correct time. In cases of men, do we really need to get their TSH level done? Not usually, but only in cases where they are suffering from erectile dysfunction, or there is ejaculatory dysfunction, or there is abnormality in the semen parameter. Many a times the patients are worried in starting the thyroid medicines because they feel that they have to take one tablet every day. So they are hesitant in starting the medication. But let me tell you that if your thyroid levels are borderline or minimally raised, there is a very high chance that your thyroid medicines might be stopped after your treatment or once your pregnancy is complete. So in order to conclude, I would say that detecting thyroid disorders at the correct time is very essential, both if you are trying to cope in fertility and during pregnancy as well. Thank you.
Book a free consultation today.